Hello and welcome. I would like to start by thanking you for considering us for your procedure. The purpose of this video is to inform you about eyelid surgery, also known as blepharoplasty. Let's start. What is an eyelid surgery? It is the removal of excess skin and fat pads from the upper and lower eyelids. Patients who are good candidates for the procedure usually complain of a tired look to their eyes. They are looking for a rejuvenation that can reflect better the youthfulness that they feel inside. Some of the findings of the aging of the eyes include fine wrinkles, deep wrinkles, fat pads or bags, and skin sagginess. What can we correct with the eyelid surgery? The excess skin to the upper and lower eyelids, in addition to the excess fat pads, also known as bags. Let's discuss now some contraindications for this procedure. First and most importantly, smokers and non-controlled diabetes have increased tendency for healing issues. Other medical problems such as hypertension, blood thinners, and COPD have increased problems for bleeding. Important medical history include former surgeries to the face and face trauma. Now let's review some important considerations in preparation for your surgery. In preparation for your surgery, your health should be as good as it could be. Medically stable, especially if you have hypertension, diabetes, or anemia. When it comes to the labs, I would require that your hemoglobin should be greater than 12. Finally, ideally your weight should be stable or close to ideal. One of the most important topics in preparation for your surgery is to stop smoking. Please do not smoke 4 weeks prior to your surgery and 4 weeks after your surgery. This includes cigarettes, marijuana, and hookah. Also, please stop any blood thinners. This may increase bleeding during your surgery. Smoking has been demonstrated to increase complications with this procedure. Please do not smoke 1 month before and 1 month after your surgery. For out-of-town patients, we'll ask them to arrive 2 to 3 days prior to your surgery. They should stay 5 to 7 days after the procedure. We'll require a medical clearance. Now let's discuss some events the day of your consultation. We will do a thorough physical examination. I like the comprehensive approach, where we will do an upper and mid-face analysis. When analyzing your upper face, we will pay attention to your forehead, the brows, the glabella or frowning area, the temporal area, the upper eyelid, and the lateral canthal position. How is eyelid surgery done? My preferred way of doing eyelid surgery is under general anesthesia. The duration of the upper eyelids is around 1 hour, the lower eyelids around 2 hours, and both around 3 hours. Here you can appreciate the markings for eyelid surgery. We will determine the excess skin to the upper and the lower eyelids. In addition, we will mark the fat pads. The upper eyelid incision will be hidden in the supraciliary position. For the lower eyelid incisions, I will use 2 approaches. The first one is the transconjunctival approach that will allow me to remove the fat pads. The second approach for the lower eyelid incision is the subciliary one, as described here. This allows me to remove the excess skin. Here you can appreciate the heel incisions of a patient that underwent upper and lower blepharoplasty. Now let's discuss how this procedure is done. We will elevate the skin of both the upper and the lower eyelids. We will retrieve the elevated skin and determine the excess skin that needs to be removed. This video is showing the elevation of the excess skin to the lower eyelids. Here you can appreciate how patients look immediately after eyelid surgery. I promise you that you will have bruising and swelling. This usually lasts 10 to 14 days. You will also experience nausea and vomiting. Usually it's the result of the medications given for your anesthesia. It will get better after 2 to 3 days. Almost all my patients feel normal after eyelid surgery. Now let's talk about risks and complications. The purpose of this section is to inform you, not to scare you. The more that you know, the most likely the operation will succeed. I have always believed that knowledge is power to my patients. Let's start by recognizing that the more tissue that we need to remove, the most likely we will run into complications. However, I will be at your side the whole time to have you sailing through any problem we run into. Infection of the skin is a potential complication of this surgery. I haven't had this complication in my practice. You will have antibiotics during your surgery and after your surgery. If present, we might need to do a hospitalization and potentially surgery. Bleeding is described to happen in less than 1% of the patients. Usually the cause is hypertension, blood thinners, and smoking. Please do not smoke. The management is drainage, evacuation of the accumulated blood, and potentially surgery. Most of the time, bleeding will translate on bruising of your skin. In very rare occasions, the bleeding might migrate behind the eye glove, also called as retrovulvar hematoma. This rare condition may need an emergent surgery. Once again, I have not seen my first one, but you need to know about this. Skin necrosis or death of the skin is secondary to poor blood flow. It can happen in revision eyelid surgery with significant scar tissue. It is definitely more frequent in smokers. Please do not smoke. Asymmetry is one of the most frequent complications of eyelid surgery. Remember that in many cases, patients have imperfections and asymmetries as their baseline. I will point out this imbalance with your analysis. I will try to improve on them, but remember that scarring is the variable that we cannot control. Blindness is a very rare complication. I have not seen my first one. Ectropion is the retraction of the eyelid downwards. Usually this is secondary to poor scarring. The treatment is massage and suspension of the descended tissues. Lagophthalmos is the inability to close the eyelids completely. It's usually a temporary condition. It might lead to abrasion. We'll treat it with massage, drops, and potentially surgery if there is no improvement over time. Dry eyes may be the consequence of inflammation to the surrounding structures to the eye. It may resolve by itself. We'll treat it with drops and ointments. Corneal injury may happen due to dryness during your procedure. We'll use antibiotic ointments during the procedure and after it. Please do not use contact lenses after eyelid surgery. Double vision is another complication. If present, it is usually secondary to muscle swelling or due to the use of numbing medications. It usually improves within the first 2 weeks after surgery. Ptosis or eyelid droopiness is a potential complication of this surgery. The treatment may be with reoperation if there is no improvement after 3 months. A potential complication is the damage of the surrounding structures, including nerves, blood vessels, and muscles. Nerve injury is the next major complication. As you can appreciate in this diagram, the nerve is protected by the soft tissue. However, when separating the structures, the nerves can be stretched or bruised. Some of the findings are weakness to close the eyes or numbness. The management is observation. The usual recovery is 3 to 10 days. However, the final recovery may take up to 3 to 6 months. We may encounter some skin rigidity, skin irregularities, and prolonged swelling that may last between 6 to 12 months. The final result is usually after a year. Skin numbness. It is more frequent in the skin of your neck. It improves over time. It may recover between 6 months and 1 year. The skin discoloration will be worse in the first week. It will progressively be better during the second week. However, the final outcome will be obtained 3 to 6 months after your surgery. Deep venous thrombosis is the presence of clots in the legs that might travel to your lungs. The day of your consultation, I will be evaluating your risk factors for the development of this condition. If your risk is high, we might need to give you blood thinners to prevent this condition. Independently, if you are at high or low risk, walking is your best friend after surgery. Please start walking the same day after your procedure. Finally, unsatisfactory result. Unfortunately, I cannot guarantee an outcome considering that I have no control over all the variables. Here you will find a list of all the complications that we have discussed so far in the presentation. I will do my best to avoid these potential complications. Most importantly, I will be always to your side, trying to correct any potential issues that may happen. Now, let's discuss some events around your surgery. The day before your surgery, you need to stop eating or drinking after midnight. I will encourage you to take Tylenol, 650 mg, every 6 hours, starting the day before your surgery. At the day of your surgery, at 4 o'clock in the morning, with a small sip of water, you're going to take your usual medications. You will also take Tylenol 650 mg pill. I will ask you to hold your diabetes medication. Pain-wise, most of the patients have a moderate level of pain. Usually they describe it as dull pain secondary to bruising. The score is between 5 to 7 over 10. However, it is well controlled with pain medications by mouth. We will give you a specific regimen the day of your surgery. We will use multiple medications for the control of your pain. We'll use Tylenol at 9, at 3, at 9, and at 3. We'll use ibuprofen at 6, at 12, at 6, and at 12. We'll use oxycodone every 6 hours and Valium if we work with your muscles. After your surgery, you will have nausea secondary to the medications used for your anesthesia. We will encourage you to eat light food, and you can work your way up as you feel better. You will go home the same day after your surgery. We will encourage you to walk to prevent clots that can travel to the lungs. The follow-ups after your surgery will be as follows. 1 week after your surgery, you will have your first follow-up. You may come at the second week for stitch removal if the stitches have not dissolved by themselves. Then you will have a regular follow-up at 6 weeks, 6 months, and 1 year. Now let's discuss some frequent asked questions related to this procedure. The skin changes after your surgery will be as follows. The surgery will create inflammation to the tissues. This will result in hardness to the skin. You may feel a deep stitch to the corner of your eyes. All these conditions will improve with time. The time of work will be between 3 to 7 days. However, the social time off will be longer, up to 2 weeks, so the black and blue can go away. You will feel 80% by 3 weeks. After your surgery, you are encouraged to walk to try to prevent clots in your legs. Please do not lift heavy. In the first 3 weeks, you need to lift less than 5 pounds. Between 3 to 6 weeks, up to 10 pounds. You might get back to normal after 6 weeks. You can shower 2 days after your surgery. When can I drive again? When you are off narcotics. If not, you will be considered DUI. Usually it takes between 1 to 2 weeks, but it varies by procedure. Now, let's review some patients that have undergone this procedure. This beautiful young patient was in her mid-30s. She was tired of the negative feedback of her coworkers regarding the tired look of her eyes. Her main concerns were the excess skin to the upper eyelids and the puffiness or bags to the lower eyelids. She underwent upper and lower eyelid surgery. To the right, you can see the perkier and more crisp look of her beautiful eyes. This beautiful patient was in her 40s. She was tired of the tired look of her eyes. Her main concern was the excess skin to the upper eyelids. She underwent upper eyelid surgery. To the right, you can appreciate the perkier and more crisp look of her beautiful eyes. This beautiful patient was in her 50s. She was tired of her look of the eyes. Her main concerns were the excess skin to the upper eyelids and the puffiness and bags of the lower eyelids. She underwent upper and lower eyelid surgery. To the right, you can appreciate the perkier and more crisp look to her beautiful eyes. This patient was in her 50s. She was tired of the look of her eyes. Her main concern was the excess skin to the upper eyelids. She underwent upper eyelid surgery. To the right, you can see the perkier look to her beautiful eyes. This patient was in her 40s. She was tired about the look of her eyes. Her main concern was the excess skin to her upper eyelids. She underwent upper eyelid surgery. To the right, you can see the perkier look to her beautiful eyes. This patient was in her 40s. Her main concern was the excess skin to the upper eyelids. She underwent upper eyelid surgery. To the right, you can appreciate the improved look of her eyes. This patient was in her 40s. Her main concern was the excess skin to the upper eyelids. She underwent upper eyelid surgery. To the right, you can appreciate the perkier look to her beautiful eyes. This patient was in her 50s. Her main concern was the excess skin to the upper eyelids. She underwent upper eyelid surgery. To the right, you can see the perkier look to her beautiful eyes. This patient was in her 60s. Her main concern was the excess skin to the upper eyelids. She underwent upper eyelid surgery. To the right, you can see the more crisp look to her beautiful eyes. This beautiful patient was in her 60s. Her main concern was the excess skin in the upper eyelid. She underwent upper eyelid surgery. To the right, you can see the perkier look to her beautiful eyes. I hope that this video was informative and that helped you understand better the details related to your procedure. If you have any further questions, please do not hesitate to contact us. I'm looking forward to participate on your transformation. Thank you again for considering us for your surgery.